Millions of people wake up every day fighting a quiet battle against their own bodies. Chronic indigestion, aching joints, painful menstrual cramps, and a sluggish metabolism have become the accepted baseline for modern health. We often attempt to fix these individual symptoms with a cabinet full of specialized synthetic medications. In doing so, we ignore the natural remedies hiding in plain sight for centuries. This is Zingiber officinale, commonly known as the ginger root. For over 2,000 years, it has served as one of the most reliable and widely cultivated medicinal plants on Earth. Long before modern pharmacology, practitioners of Ayurveda and traditional Chinese medicine relied heavily on ginger. Ayurveda is an ancient Indian medical system focused on balancing the body, mind, and spirit through diet and herbal treatments. In these traditional systems, ginger was prescribed to treat the patient as a whole rather than isolating a single symptom. The true power of this root lies in its chemistry. It actively adapts to and restores balance across three distinct physiological systems in the human body. The first system it targets is the human gut. Inside the root are active phenolic compounds called gingerols and shogols, known for strong antioxidant and anti-inflammatory properties. When ingested, they interact directly with the stomach lining, stimulating gastric contractions to accelerate food emptying into the intestines, while calming localized inflammation. While the physical digestion speeds up, ginger also intercepts communication to the nervous system. It blocks the specific serotonin receptors in the brain that trigger the sensation of nausea, making it highly effective for treating morning sickness during pregnancy or acute motion sickness. By clearing the physical backlog in the stomach and shutting down the neurological nausea trigger, ginger operates as a highly efficient, dual-action digestive aid. Beyond the digestive tract, ginger exerts a powerful influence over the musculoskeletal system. When tissue is damaged, the body produces specific enzymes, known as COX and LOX, that trigger inflammation and pain. COX and LOX are proteins that act as chemical messengers to signal the body's inflammatory response. Ginger naturally inhibits these exact pathways, cooling and neutralizing inflammation at the cellular level before it can spread. Because it interrupts these pain pathways so effectively, oral ginger is frequently used to treat dysmenorrhea. Dysmenorrhea is the medical term for severe, painful abdominal cramps experienced during menstruation. In clinical trials, ginger has reduced this pain just as effectively as over-the-counter medications like ibuprofen. The anti-inflammatory effect also works from the outside in. Applying a warm topical compress directly to the skin provides targeted relief for the stiffness of osteoarthritis and deep muscle soreness. Whether ingested to calm acute internal cramps or applied externally to soothe chronic joint degradation, it offers a complete botanical alternative to synthetic pain relievers. The third area of influence is the bloodstream, where ginger dictates long-term metabolic function. This chart shows the measurable impact of daily ginger consumption on blood chemistry over several weeks. We see a distinct downward trend in both fasting blood glucose and HbA1c. HbA1c is a blood test that measures your average blood sugar levels over the past 3 months, used to diagnose and monitor diabetes. Looking at this comparative bar graph, we see ginger's secondary metabolic effect on the lipid profile. Regular consumption actively lowers bad LDL cholesterol and triglycerides, while simultaneously boosting levels of healthy HDL cholesterol. LDL is the bad cholesterol that builds up in blood vessels, and HDL is the good cholesterol that helps clear it away. By keeping blood sugar from spiking and clearing excess lipids from the arteries, this combination of cardiovascular and glycemic regulation forms a protective shield against metabolic syndrome. Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease and type 2 diabetes. Consistent blood regulation provides a mechanism for long-term metabolic stability. We have a single plant that calms the gut, soothes the muscles, and stabilizes the blood. Accessing this potent chemical profile requires returning to the traditional methods of preparation utilized by ancient herbalists, extracting active compounds directly from the raw root. Brew freshly sliced root in hot water to create a tea for internal digestive health. Apply aromatic oils and warm compresses to target topical pain, or grate the raw plant into daily meals to maintain long-term metabolic balance. This accessible root provides a specialized toolkit for everyday recovery, matching the efficacy of conventional pharmaceuticals for nausea and inflammatory pain in several clinical contexts. So the very next time you see ginger sitting on your kitchen counter, look at it as a potent biological tool, ready to help you safely and naturally take control of your holistic health.